Thank you, James. Very good morning, everybody, and it's a great pleasure and honor to be here in this historic building and to share some of the views which now shift a bit to the more international scenery. Now, I'll try to go a bit first, what's the World Health Organization position in the standard setting, what it is doing, scratching a bit surface, experiences, coming closer, key elements for success, for harmonization, and some concluding remarks. Now first, what is this World Health Organization? Because everybody thinks everybody knows it, but I think many people really don't know what animal it is. And actually, it's the directing and coordinating authority on international health within the United Nations system. So it's a specialized UN agency. And of course, it works with a lot of stakeholders, but the factor which sometimes also is not realized that the World Health Organization is owned by the member states. And I have said sometimes the World Health Organization is really a secretariat, but sometimes you could put an analogy, try to be a good kid for the 193 parents. Usually guys have 2 parents. We have 193 parents, and try to be a good kid to them. That's a bit a challenging task, I must say. Now, World Health Organization is not, of course, the Geneva office, which is headquarters, but it's much more. It has 6 regional offices. And, of course, I'm extremely pleased that our colleague from the PAHO AMRO office, American office, which is having its headquarters in Washington, D.C., is here. But we have also headquarters for the regions in Manila, in New Delhi, in Cairo, in Copenhagen for Europe, and Brazzaville in African region. On top of that, you can see on this map a lot of stars, and these stars are actually designating the country offices. And the country offices, in turn, are very different in size, because in some countries we have quite substantial country offices with a lot of technical knowledge, and in some other countries it's very limited staff and of course can't have much specialized technical knowledge. Now, what are the WHO activities in the field of health products regulation, which includes medicines, biologicals, vaccines, of course, in their medical devices? It is setting norms and standards, but in a very broad term, we are also involved in assessment of national regulatory systems, giving regulatory support to the countries to build up functional regulatory systems, and doing a lot of capacity building. There was mentioning yesterday about 500 people going through the training courses. I think only from my unit, which is not all WHO doing in this area, I think we counted a couple of years, it was 1,500 plus people going through the different training courses in different parts of the world. But this is only one part of the activities, because regions have their own activities and sometimes country offices do certain bits and pieces as well. Then it's also, which is very relevant, promoting harmonization and information exchange on safety, quality and best practices. And also, last but not least, which was also mentioned yesterday by some speakers, assuring safety and quality of selected products for United Nations family through pre-qualification programs, which have 3 arms: medicines, vaccines, and diagnostics. Now, standards and WHO. WHO is one of those organizations who, in the very early days when it was actually founded after the Second World War, and inherited some of the standard-setting activities like international pharmacopoeia even before the Second World War times. But basically in its constitution, it's mandated to develop, establish and promote international standards with respect to food, biological, pharmaceutical and similar products. Now, coming again to short and trying to focus on the major areas how these standards are made, it's actually made through the WHO expert committee system, and I'm mentioning only the relevant expert committees in this context. This is WHO expert committee on specifications for pharmaceutical preparations, which is dealing a wide broad of standards, starting from the GMP for finished dosage forms, but also going to the bioequivalence and many other. guidances and norms and standards, also having under its umbrella international pharmacopoeia, but going beyond, going to the guidance like good distribution practices, which are very important for the supply chain security. And then coming to the WHO Expert Committee on Biological Standardization, which is very much doing also the standard setting for the vaccines and biological products, including blood products, which is a very special and, I'm always saying, neglected area of products. And now how it fits together and how it does the job. Actually, the job, how the expert committees do, WHO has a lot of panels of experts, and there are certain rules and procedures how people can get into the expert panels. And now expert committees derive their expertise from these expert panels, and it's not fixed that you can derive only on one panel, you can derive from all to get the comprehensive knowledge around the table. And the experts are usually global. They are covering all WHO regions and countries, and expert committees are also open to the observers from the industry parties who are organized, and also to some of the professional organizations who are very interested in topics. They have also observer status, they can come in. And also it's a quite transparent process because the drafts are circulated for the comments and everybody can make comments to them. And of course, it has been evolving during the time, because when WHO, I saw some historic booklets, WHO standards for the safety of medicines, it's the preclin safety, and some other very exciting things in very early days, but which were tuning to start to go to the new product development area. But then at certain time, WHO took a decision not to go in a competition with some standard setting activities, but to focus on this, which are more complementary and relevant to the majority of our stakeholders. And this is what could be said also today, that we were talking yesterday a lot about ICH, WHO's observer in ICH, and what WHO expert committees are doing are at large complementary to the ICH activities. They are not really duplicating ICH activities. And there are also spillovers, because some of the WHO standards today are de facto ICH standards, because WHO GMP for APIs, after some hesitations from some parties, was finally accepted as a common standard. So it's de facto now endorsed for the much wider audience. Now, going further, there is another area that WHO is involved in, some nomenclatures. It's international non-proprietary names for the medicines. And of course, people could say everything starts with a name. It's mandated in 1950 by WHO World Health Assembly resolution, standard setting activity. And for today, when we're early stages, there are a lot of nomenclature bodies dealing with issuing similar non-proprietary names. Today, there are very few left on the playground, and de facto WHO international non-proprietary name is a world standard, because if we take what USAN, who is still one remaining players on the playground, are doing, we have practically 90% the same. So there are some legal other reasons where there is slight differences for certain markets, but at large it's the same, it's harmonized. Now, we are doing also, as I said, assessments of regulatory systems. It's an evolving process, because assessment tool is only as good as are those who are doing it, and as good is their thinking in terms of taking the change on the board, because regulatory systems are evolving and developing. And we are now in another stage of developing a more comprehensive, more harmonized tool. And there is a lot of assessment work ongoing, and this is one of the reports that is in the public domain for the sub-Saharan Africa. But as everything printed, it's out of date, because that's the tragedy with everything you want to print. Then this is the website where you can find more information. Then another very interesting and important fora that WHO has been, together with the member states, with the regulators in countries, hosting its International Conference of Drug Regulatory Authorities. This is the biennial global meeting bringing together usually regulators from 100 nations, and it has a very important role of promoting information sharing and best practice exchange, cooperation, harmonization, and convergence. And several initiatives started actually in ICTRA environment. Some of them have been spinning out. Some early discussions on ICH were actually taking part in ICTRA environment, but then a group of the countries were going with a more specified feel out. Also, African Medicines Regulatory Harmonization Initiative, discussion started in ICTRA environment. And also it has been a feedback forum from different harmonization initiatives and trying to distill good parts and lessons learned. Now there is now a very recent new harmonization initiative where WHO has been a bit taking lead, trying to get beyond BDG, Pharmacopoeia Discussion Group, trying to convene the global pharmacopoeias who are still active, there are not too many of them, and trying to go a bit further with the harmonization, because it's amazing how much differences there are still existing. And we are going to have a second international meeting of World Pharmacopoeias in New Delhi during 18th, 19th April this year. Then harmonization of regulatory requirements, it is important, but we have a bit to step back and think what is really the objective, and it is probably to improve and promote public health in wide terms. And harmonization aims to diminish duplicative efforts, creates common language, can facilitate cooperation and access to medicines, and that's what we are all doing. And in case of harmonization of regulations, the main objective should be really measurable public health gains. Can people get quick access to the medicines needed? And there may be other gains, of course, but these should not be in the center. Now, focus a bit on what are the lessons learned from harmonization initiatives, what are the key elements for success, and how can these lessons be applied. Now, there are a lot of harmonization initiatives. They're interregional, regional, sub-regional, and of course I have not listed them all. But what is very common to all harmonization initiatives, they are absolutely not harmonized. They are all absolutely different. So they're different in organization, with or without strong secretariat, different involvement in the industries and other parties, different in terms of implementation. Some are focused on implementations, others rather focused on convergent of regulatory thinking, different in focus, what is the technical areas and products. So basically, maybe you should need, so to say, good harmonization practices to pull it all together, because harmonization is absolutely not harmonized. Now, key elements of success. Of course, it's enabling environment and foundation. And one of the things is really good governance principles in implementing. And this may be too basic and too simplistic, but you have to give a bit attention to that. And also some sort of more modern legal system allowing certain flexibilities. And that was also pointed out by Michel Forsley yesterday. Political will and shared common vision, you can't work together without that. Similar socio-economic development for participating countries has clearly been facilitating how quickly move can be done. Also, participants functional regulatory authorities with necessary capacity and resources available. And that is also that you can't collaborate, because I have pointed to the empty chair and saying how this empty chair can collaborate better and do the better job. It remains empty chair. So if you don't have the necessary minimum resource, it doesn't fly. And then it's also willingness to invest into harmonization. We can say quality has its price, but you could say also harmonization has its price. It doesn't come free of charge. It's not a free lunch. It's a heavy investment of intellectual capacity, resource, and also financial resource to get it moving. It also needs effective governance and secretariat, and again we have a very good experience that those harmonizations who have very efficient secretariat are usually marching much more in a structured way. Commitment for implementation and updating and revision, because there are some harmonization initiatives who did a set of guidelines, and this set of guidelines are on the website, and nobody's implementing them. Nobody's updating them. They are there. They are there for probably somebody coming from Moon and learning the history or what. So it's also commitment for applying good regulatory practice principles when implementing the harmonized guidelines. And that's probably something coming as a next step. And I try to put here something a bit timely access to better medicines ladder. It's a bit free-floating thinking, but if you start marching, you need to have a good baseline. General good governance in public sector, including transparency and accountability. That's the baseline. You don't have it, it's very difficult to start marching. You have to have also applicable modern laws and enabling legal system. And then comes what we were focusing in the middle, harmonization and convergence of technical requirements in conjunction with harmonized training principles, and probably model curricula for regulators in the future, because the regulators' training regulates right to regulate, but nobody likes to train the regulators, and there is not really harmonized views of even how you do it. And then what is post-harmonization coming? Without harmonization probably is also not very valuable, is good regulatory practice based on CTD, let's say, this is harmonized product, alignment and effective cooperation and work sharing. And that is again that without this element, you may have harmonization in place, but it doesn't roll out. It's less predictable, the regulatory processes are not well designed. You have to have it. And then on the top you could say maybe you can go even a bit further, good decision-making practices, because that is also how you make, based on the same things, the decision. Because you may have the harmonized regulations, you may have some sort of good regulatory practice principle in place, but then how you still make good decisions based on that. Can you have some sort of principles there that take your guidance? And of course it all has to lead, what is it all for? You should never forget the focus, timely access to better medicines, hopefully better medicines, because sometimes it may not happen like that, but mostly. Now, other experiences of success. Of course, I think there is a lot to learn from European Union experience, and I put it in a way, the experience even post-harmonization. What happens when you have already, because European Union is a unique setting, 27 member states, the laws and regulations for pharmaceuticals are the same, the background is the same for all. But now, how you based on that go next? And this is the moral, that there are a lot of arrangements now in the European Union setting that only a couple of member states take the lead and do the scientific assessment. And the others are not duplicating it. They're benefiting from that. They are not doing anything duplicative at all. And some member states may prefer to be relatively inactive. In EU, there are member states who practically never take part in centralized procedure. But maybe it's the internal political decision where they put the resources, because they can do without that. The colleagues are doing it for them. And there are also no correlation between the size of the country and the regulatory impact to the European Union setting. There are very small countries, relatively, like Sweden and the Netherlands, who have relatively high impact, but not so much of the population. There are some bigger countries nowadays whose impact is much less. So it's again, Sweden probably has made a political decision to keep up the capacity of assessing new products, to have it there and to be very active. And actually from Sweden is now the chair of the CHMP. So there are several models possible. Then joint reviews of clinical trial applications and products across the borders. That's a new emerging thing that I think is very interesting and has a lot of potential. How people, regulators across the borders, can work even from different regions on the same products or the same clinical trial application and start moving. And it's African Vaccines Regulatory Forum. This is what has done something in these lines. Also, Medicines Pre-Qualification Program has taken certain products together with a number of countries, work together in the review, and in the end of the day coming to the same conclusion. And this type of things can be probably quite successful for the high public health value of products which go to the limited number of countries. Last, promoting international harmonized standards and good review by staff exchange. That's another thing that is ongoing, but probably could go even better. Because how people get adjusted to each other's thinking and bring it in board and try to have the same views. If you work together, there's nothing better than working together. It somehow takes off the corners, you know. If you don't work together, you don't achieve that. And there are arrangements for that, and in WHO we have found extremely useful. We have a 3-month rotational post for the assessors. It's not for those who are zeros. They are already advanced assessors who come in. But working together with international assessor pool, who are from different countries, gives them sort of added value when going back to their own national setting. And in concluding remarks, WHO has promoted regulatory collaboration and harmonization long time and will continue to do so, being open to new ideas. Making medicines is not anymore a local business, and the area of only locally operating regulators starts to end. Maybe some people don't like this claim, but I had to do a disclaimer before. All this, what I'm telling, is my personal views. It's not reflecting WHO official positions. The future medicines regulation is more in collaboration and networking. Regulators starting to function more as a functional network rather than individual players, and individual players focusing on what they can give the best added value. And unfortunately, we still see that a lot of regulators all around the world do things that doesn't give any added value. But they just do it. It's nice to do things, but it may not necessarily give added value. And the good example was yesterday, 22 inspections. Okay, first I can understand, second I can understand, third I can understand, I can be very flexible, I can do this fifth even. But the 22nd, sorry, something is terribly wrong. Then there is a lot of what we have tried to talk with collaborative arrangements in the also ICDRA environment. There are some very broad level suggestions like take account of one another's work with a view of improving the efficiency of the global regulatory system, commit resources to form cooperative networks based on uniformity of standards and inspection systems, engage with regional and international initiatives promoting harmonization, information sharing and use of data generated by other regulators as a tool for improving timely access to medicines and medical products. And you could say all these things are already happening, but they should happen probably in a more structured way and more efficient way. There are elements already there. Things are starting to move into this direction. Well, and then it's to put it very, very direct. It is clear that not all national regulators can fulfill themselves all the functions, and decisions have to be made nationally on which areas to focus and build capacity and in which areas rely on other regulators' work. And that is already happening, but not always also transparent, because this is the logic. And I'm always saying the WHO 193 member states, majority are small fish, very small countries. Those that some call big are also very small. So those ones who have the substantial capacity is the minority, actually. Now, harmonization alone, of course, cannot help, but can form a solid basis for the new regulatory paradigm to evolve in the future. And this could be, to put it again, very direct and short, doing locally what nobody's doing can do for you. There are many things that for regulators, other regulators can't easily do in their jurisdiction. But this is still regulatory business needs to be done, which gives added value then. And decide in which area you invest to specialize, to be a world-class player in the either regional or global or sub-regional network, because you have to decide. You can't be good in everything. I'm absolutely terribly bad in most of the things. So I should know what I'm good in. Maybe that's very limited things. Actually, I don't know if I'm good in anything. Thank you.
So thank you very much, Lambert, for that excellent and thought-provoking presentation. I think we've seen clearly that WHO has a long history in harmonization standard-setting initiatives such as the INN, the expert committee work, ICTR and the pharmacopoeias. And I think one of the questions you raised is very interesting. Is it possible to harmonize the harmonization initiatives? I think that's a thought-provoking thought. Also the importance of the functional networks vis-a-vis harmonization, and then what do we do with the smaller countries, which is really, I think, which we're working in terms of international development to strengthen capacity. So with the two presentations, one from the nuclear regulatory field, highly organized processes, complex rule organizations, challenges, introduction of the term alignment, which is, I heard a number of times during the presentation. Yesterday we talked about harmonization, convergence, and there was another term I think that might be interesting to hear a little bit more on, alignment with global regulation. And then following the presentation, WHO providing the global perspective on the pharmaceutical on pharmaceutical harmonization trends and needs. I'd like to open the discussion now and ask you if you have any comments or questions for